Hey everyone, welcome and welcome back to this YouTube channel. Welcome back to my nursing channel. So guys, today I want to talk about why a pregnant woman should take iron folic acid. So if you're new here and you have not subscribed, kindly consider clicking that subscription button. And returning subscribers, thank you very much for always clicking in. So like the video, share, comment, and don't forget to turn your notification bell so that every time I post a video, you will be the first person to get notified. So as I have said, we want to talk about reasons why a pregnant woman should take iron folic acid, or advantages of taking iron folic acid when you are pregnant. And before that, let me say that African usually don't go for preconception care, and we know that this iron folic acid should be a pregnant mother or someone who is planning to get pregnant should start taking them before they get pregnant. That is why that is when they will be more useful than compared to someone who has who started taking them when she had already become pregnant. So so before I talk about the reason why a pregnant woman should take iron folic acid, I want to say that when you are planning to get pregnant, kindly consider going for preconception care, because it is not only that you are going to be given those iron folic acids or pregnancy supplement, but it is helpful because that is the time the doctor or the nurse can identify some conditions that may interfere with your pregnancy, or that is the time when you have some condition. Those conditions can be managed well, so that by the time you get pregnant, you already know what you're supposed to do. You are already managing the condition, and you will not get any complication when you are pregnant. So the first thing that I know you are asking yourself is that, when should I start taking iron folic acid? Yeah, iron folic acid, IFAS. When should I start taking IFAS? IFAS should a pregnant woman or someone, let me say, if you're planning to get pregnant, you should start taking IFAS 3 months before you get pregnant, so that by the time you're getting pregnant, the content of those drugs are already in your blood, and so they are able to prevent you from, or prevent your baby from getting so many complications that we are going to look at in this video. So let's say that birth defects occur the first 3 to 4 weeks of pregnancy. So it is important to have folic in your system during those early stages, because this iron folic acid will help your baby's brain and spinal cord to develop well, because I've said that the 3rd and the 4th week, those are the time the development of the baby is taking place. So those are the crucial time that you should or it should get when the content or the iron folic acid is already in your system, or those are the time you are supposed to take those medications where the way they are prescribed with a lot of cautions. Another thing that you should know, another thing that you should know, or you should have at the back of your mind, is that iron folic acid should be taken 3 months before you get pregnant, or if you are late, 1 month before you get pregnant, or the first few months, the first trimester, you should be taking iron folic acid, and also within 9 months of pregnancy you should be taking iron folic acid, and also 6 weeks breastfeeding, you should be taking iron folic acid. Yeah, So we are going to look at the benefits of taking iron folic acid. We are going to look at some of the benefits of taking iron folic acid. Without folic acid in your body, your baby's neural tube may not close correctly, and they could develop health problem called neurotube defect. So these neurotube defects are the spina bifida and encephaly. So the spina bifida is in complete development of the spinal cord or the vertebra, and encephaly is in the incomplete development of major parts of the brain. So baby with encephaly usually do not live long, and those with spina bifida may be permanently disabled. There are scaring problem to say the least, but the good news is that getting enough folic acid may protect your baby from getting neural tube defect. When taken before and during pregnancy, you may protect your baby also against the cleft lip and the cleft palate, and also you may prevent yourself from getting premature delivery or birth. You might also prevent your baby from being born with low birth weight. Miscarriages are also prevented when you are taking this iron folic acid. Poor growth in the womb also is prevented when you are taking this pregnancy supplement. So folic acid has also been suggested to reduce the risk of pregnancy complications, and also when you are taking iron folic acid, you see it is iron folic acid. It is one drug with 3 components. So when you are taking all these pregnancy supplement, you prevent yourself from having low HB. And you know, when you are having low HB, also you are putting yourself at risk of other conditions, or you are putting yourself from getting a premature baby, and also from having postpartum hemorrhage when you give birth. So I know some people may ask themselves, or may say that I did not take any pregnancy supplement and I gave birth to a healthy baby. Let me tell you, you know, some of the foods that we usually take, some of them have this iron, some of them have the folic acid, some of them have zinc, some of them have the vitamins that are needed when you're pregnant. So if you did not take a pregnancy supplement, maybe your blood system, or you are taking foods that has this content that are needed, content of these pregnancy supplements that are needed when you are pregnant. So examples of these foods are the fruits, the eggs, the broccolis, the liver. Yeah, those are some of the food that contain these iron folic acid components. And remember that I want to emphasize that it is always very important that you go for your preconception care, because if you don't go for preconception care, you are putting your baby at risk of getting congenital abnormalities. You're putting your baby from getting disabilities. And remember, it is said that because the Africans are the people who usually don't go for this preconception care, they are the people who have a lot of disabilities and a lot of congenital abnormalities when they give birth. So consider going for your preconception care, so that even if this congenital abnormality run throughout your family, they can be prevented. Yeah, they can be prevented, apart from those congenital abnormalities that come with the maybe defect in the gene. And also preconception care is very important, because I said there are some conditions that you might be suffering from hypertension and you didn't know. That is the time you can, the doctor can identify the condition and you can get treatment. The condition can be managed, and by the time you are getting pregnant if you already know what you're supposed to do and how you can manage the condition. And also you can also be aware of the HB, your HB, and the doctor will always advise you, that you should not get pregnant when your HB is low, because you are putting yourself at a lot of risk, and also your baby, you are also putting a lot of problem. You're putting a problem. You're putting your baby at risk of getting a lot of problem at low birth weight and so many others. So today we have learned that advantages of taking iron folic acid. Number one, I'm summarizing so that you get the point. Number one, it prevents your baby from getting the neurotube defect, the spina bifida, and the encephaly. I've already I've already explained what spina bifida and encephaly is. Also, the cleft palate, it prevents your baby from getting the cleft palate. Also, it prevents your baby from being born with low birth weight, and also it also prevents your baby from being born with congenital abnormalities, and also it also prevents you from getting low HB. And you know, low HB put you at risk of giving birth before term. It put you at risk of giving birth to a premature baby. It put you at risk of getting a baby with low birth weight, and those are some of things that can be avoided. So consider what I've said as an important as your life. So I think I will stop from there. So let's meet in the next video. Bye till next time.